How are you? I'm Dr. Ismail.
Hi, nice to meet you.
So I have in front of you the patient.
Uh-huh.
All right, sleeping on the bed. Can you see the patient?
Yes, I can.
All right, and this is the mom.
Hello.
All right.
How old is our patient?
Our patient is a year old.
And what's their sex?
It's a boy.
It's a boy. All right. And what brought them in today?
Yeah, he came in. The mom brought him with a history of fever,
Mm-hmm. Yeah.
cough, and difficulty in breathing.
Difficulty in breathing. All right.
Yeah,
And is the fever continuous or does it come and go?
yeah. The fever is intermittent, comes and goes.
Intermittent. And
Yeah.
has the baby is it dizzy? Does he experience any stomach pain at all?
No stomach pain.
No stomach
Of
pain?
course, he wouldn't be able to tell if there's dizziness,
Yeah.
but there's no stomach.
No
Yeah.
stomach pain. All right, and how high is the
Yeah.
fever?
Yeah, the fever is high, and the mother described it to be very high,
Very high.
but it's intermittent. Yeah,
It's intermittent, so it comes and goes.
yeah,
And
yeah.
when the baby coughs, does he cough anything up?
No, he doesn't.
He doesn't cough anything up.
Yeah,
But he has difficulty breathing.
yeah, he has difficulty in breathing.
Um, when we did a chest X-ray, did that show anything?
Yeah, it shows it was positive for respiratory tract infection.
Respiratory tract infection. All right, and
Yeah.
did we run a rapid diagnostic test?
Rapid diagnostic test was also done. It was positive.
It was positive. And did we run
Yeah,
a microscopic test to see what the pluses were for malaria were?
yeah, tuberculosis.
2 pluses?
Yeah,
2 pluses. All right, so
yeah.
the patient has uncomplicated malaria and
All right,
an acute respiratory infection, and I
all
recommend
right.
treating the malaria with ACT, the like oral
Perfect. Yeah,
tablets, and I also recommend treating the respiratory infection with since it's I believe. Wait, do we run a blood culture to see if there's bacteria in the bloodstream?
perfect.
Was
The
okay.
blood culture was taken, it was negative.
Negative. So that
Yeah,
means that the respiratory infection was viral.
yeah,
And we can really only treat that through supportive therapy and hydration.
perfect.
And and for the malaria, I recommend for the fever, if it stays for a long time, an antipyretic so it doesn't get too
All right,
high. And to prevent malaria from happening again, wear long sleeves, mosquito spray, and for the respiratory infection, I recommend just having him rest a lot and
yeah,
just good hygiene.
yeah.
And yeah. And he didn't experience any other symptoms at all besides coughing and pain.
No, none.
All right. Can you thank his mom for being here with us today, please?
Yeah. Tana musu ta yi bayanin abubuwan da ya kamata a yi na abin da ya shafi na wannan zazzabi. Kamar kin san ya zazzabi na zazzabin cizon sauro ne ko? To abin da ya kamata kamar kuna da gidan sauro? Yawa a dinga kasance a cikin gidan sauro ko da yaushe kuma ya kasance cewa ba barin sauro ya cije shi da sauransu. Bayanin da likita ta yi yanzu kenan. Kin gane ko? Yawa. She understands you perfectly, and I just want to run through some of the things we discussed.
Yes.
Okay. Dr. Melia, you did perfectly well. And if
Thank
I were
you.
close by, I would have given you a handshake. All right?
Thank you.
Yeah, you did well. Absolutely well. You did brilliant. Have a lovely day ahead.
You too.